All right, welcome back. Well, now we are turning our attention to developments in Kano. We've got Dr. Mansour Ramalan, who is a consultant physician, I believe with AKTH. But then, Doctor, thank you for joining us. But we also will be joined by Dr. Tijani Hussaini, who is the coordinator, technical response team for COVID-19 in Kano State, also from our studios in Kano. Okay, so we will be getting to them in just a moment because as you may have seen, if you did catch the opening session of a program where some of the data is already highlighting tension in Kano as a result of the death toll rising. Some reports put it 14 dying in the last 2 days. And I do remember one of the deputy coordinators mentioning a certain number at about 640 deaths. So we're hoping that they'll be able to shed some light on those matters now as we eventually will get to them, to get to hear them speak on some of those matters.
One of the things that would be nice, very, very good to hear this morning is, on the one hand, those mysterious deaths. Yeah. On the other hand, and more importantly, how the people of Kano are being carried along in the education as far as COVID-19 is concerned, because there are issues, there are information out there that people are bandying around that there are some influential people in Kano who have large following, who are not sure whether or not there is COVID-19 in Kano. Some even say to them that there is no such thing as COVID-19. How far-reaching information to the residents of indigenous and residents of Kano has gone is something that would be good to hear this morning.
All right, let's cross over and get to Dr. Mansour Ramalan from our studios in Kano. Good morning, Dr. Ramalan. Thank you for joining us today. What can you tell us? What have you seen playing out in Kano at the moment?
Good morning. There are reports that there are increased rate of deaths among most especially elderly, and these reports have been reported in some papers and some media outfits.
So, could you please go on? I'm not sure. Quite conduct. What are the challenges that you have seen, and how are these challenges being taken on board? Because you would agree that the information that's gone out to the world, to Nigerians about Kano is quite worrisome. What have you found out preliminarily?
Preliminary, I believe access to care may be a contributory factor because as a result of the lockdown, some of the hospitals have scaled down their services, and quite a number of these elderly people already have some existing medical conditions like diabetes, hypertension, heart diseases, and so on and so forth. Seeking care for them to optimize their conditions is very important. So I believe it may be a contributory factor, although we don't have information yet as to the exact causes of these deaths. Investigations are still ongoing, but I believe access to care may be a contributory factor to it.
Has any post-mortem been conducted on any of the incidences before burial occurred?
At the moment, we don't have any information as to whether such investigations have been conducted, but we expect that these investigations will be done as early as possible in order to allay public fear and to calm people and prevent panic.
Dr. Ramalan, how is it that all of this that were happening, they were burying people, and no one seemed to find out what was going on, what was causing all of this until it blew up in the media? How could this even happen?
Usually events like this happen from reports, and when there are reports of some unusual activities, the authorities concerned usually will investigate, and scientific information will be brought out to the public domain. what we expect is the investigations and the results of investigations to be conducted as early as possible and the results made public as soon as we can. So in this kind of situation, especially as regards to the pandemic we are experiencing at the moment, it is crucial and very important that such information are brought to the public domain as early as possible.
Also, I'd like to know the feeling, in Kano. Are the people worried? Do they see this as unusual? Is there some form of, I don't know, panic in the place?
Of course, people will be worried with any unusual activity. Even the healthcare workers, quite a number are concerned, especially the fact that no one truly knows exactly the causes or factors that are responsible for these deaths.
But, yeah.
Okay. So now, I like to, the reason I ask is because, a lot of people over time hear about these announcements and they go, well, it's the will of God. Let's go on. And it appears that this keeps mounting. So I'm wondering, is there like a religious or cultural perspective that is maybe slowing down this process of investigation? Maybe people just think, well, it happens. Let's just move on.
There are many things that could have contributed to that. Because of the lockdown, it's difficult for people to do quite a number of things. And also, these reports were collected from different places. So it takes time before generally the information will be collected and certain level of awareness and information dissemination will take place. But I don't think it's mainly the cultural and religious perspectives that may have delayed the reports from going out public at their time it should have gone out.
Okay. From your perspective, you talked about awareness creation and all of that. Now, from your perspective, do you think the residents are aware? Do you think they have sufficient information or knowledge about COVID-19 and the reason for the lockdown and the need for them to stay safe? Do you think they have sufficient information?
I don't think the public have sufficient information about the lockdown and the need for them to keep certain behavioral practices within this period, because we've seen a lot of videos and some information of people having some mass gathering, social activities like playing football and some cultural practices. And I think that there is the need for the public to play their own role in terms of behavioral modification, because there are no two ways about it. The pandemic is here with us, and whatever we do will determine how fast or how early we get out of the trouble.
The ones you said you saw not complying with the restrictions, was it several days ago, or are you talking about yesterday?
Even a couple of days, and even yesterday, I've seen places where some people are not keeping to some of the instructions and practices that we expect people to keep to with regards to the social distancing and behavioral practices.
So there are different figures, really. What figures do you relate with at the moment concerning those deaths?
Well, for now, the official figures that were released by the government are the figures that we should rely on. But let me say at this moment that people are dying, and not all the deaths may be recorded even by some health institutions, because the situation we're in now, especially with regards to the issue of the lockdown, some people may actually bury their loved ones without bringing them maybe probably to the hospital, and in some institutions they scale down their services, so some people may not, some deaths may not be recorded.
You're a consultant. What are the health medical professionals? What is their view of all this? What do they refer to or attribute as the causative factors to some of these deaths?
Well, at this stage, it's difficult to clearly say what is responsible for the deaths, except if there is adequate scientific information. But I know quite a number of people are having the fear and panic that within this period of the pandemic that the death could be related to COVID-19. And quite a number of people are feeling that the access to care for especially the vulnerable group, aged people and people with some medical conditions like diabetes, hypertension, and heart diseases, the access to care has not been optimal since the lockdown commenced. And you will agree with me that these are the group of people that are vulnerable, and they are the group of people that are likely to suffer more when they get infected with COVID-19. So we're a bit concerned that the healthcare services access have to be given to people of that category so that we prevent them from having the problem of COVID-19.
All right, let's wind down with this now. What kind of cases predominantly is AKTH attending to at the moment?
Well, officially I'm not in capacity to discuss such cases, but I know to the large extent the hospital has been attending to virtually almost all cases, and the hospital is actually filled to capacity, and quite a number of times the hospital is now currently attending to virtually 2 to 3 times the number of patients that have been coming into the hospital previously. So the number has more than doubled or quadrupled. And partly because some of the private hospitals that were attending to some of these patients before now have scaled down their services because of the lockdown and fear of attending to patients with COVID-19. And I believe that somehow probably the government may need to instruct some of these hospitals to open up for services because patients have to access care even within the lockdown period. We have not reached the proportion of large-scale proportion of pandemic seen in other countries that services will be scaled down in favor of COVID-19 patients. So I believe we should open access to other categories of patients to access care.
All right, Dr. Mansour Ramalan, thank you very much indeed for talking to us this morning. Back in just a moment, and then we'll get to hear what the government is doing about this. Stay with us.